Across the country, nursing homes have been hit hard during this pandemic. According to new data, 1 out of every 3 COVID deaths is a nursing home resident or worker. Here now to share what one company is doing to make a difference in their assisted living facilities is the Chief Compliance Officer of Communicare, Fred Stratmann. Fred, thanks so much for joining us.
Good morning, Lindsay. Thanks for having me on.
So Communicare owns and operates more than 90 centers and assisted living facilities across 7 states. And we all know that nursing homes are among some of the hardest hit during this pandemic. What are some of the things that you're seeing and fighting during this crisis?
Well, one of the things that we're seeing that is really worth mentioning today is we're actually starting to see progress. We see, 100 individual cases every day of residents moving off of the COVID units, but something that we're seeing in some of our centers is large numbers. We have a center in Cincinnati called Burlington House. It's one of our flagship facilities in our hometown. Last week, they moved 48 residents off of the COVID unit. There's 2 centers in Indiana that are anticipating moving as many as 100 residents in the next week and a half off the COVID unit. So we're seeing progress. Yes, we see, COVID spreading in the nursing homes. That's a fact, but we are seeing aggressive efforts to treat it, to help the residents, and to actually be successful in our treatment efforts. And that's an important thing to note today.
And let's get specific there. What are some of the things that your company is doing to mitigate the effects of COVID in your nursing homes?
Well, one of the first things that we did was we put an action plan in place in early March. In March 3rd, we directed all of our centers to start screening every employee, every visitor, every vendor, every provider who came in. We were going to screen them for symptoms, and if they had symptoms, they were not going to be allowed in. We revised that policy on March 10th to stop all visitation. And I want to note that that March 10th day that we stopped all visitation was a full 3 days ahead of the CMS guidance to that effect. So we wanted to create these isolated communities to delay the onset of COVID into the centers as much as possible. And we were pretty successful in doing that. But obviously, we couldn't keep it out. You've talked about transmissibility. You've heard Dr. Ashton talk about the things that we don't know about how COVID spreads. And certainly, we see that every day. So we're very aggressive in making sure that we're taking all precautions we can. We have established great isolation procedures in all of our facilities, and our company has been very, very aggressive in terms of providing PPE and testing in our centers. We went out on our own. We purchased over 3,000 test kits in mid-April, and we're testing in our hotspots where we would start to see an uptick in symptoms like fever, shortness of breath, loss of appetite, fatigue. And then we also provided our staff with a great deal of PPE. Our company shipped more than 46,000 N95 masks out to the field. We shipped over 38,000 face shields. About 200,000 isolation gowns went from our center to our home office to the centers. And that was to supplement whatever they were getting from the suppliers and from state and local government that were helping as well. So we've really been aggressive about how we're dealing with this. From a treatment perspective, we have also put a lot of our residents on those who are clinically appropriate on anticoagulants. You heard stories about strokes and blood clotting in many victims. So where it's clinically appropriate, we're treating them with anticoagulants to reduce the risk of that. We're finalizing our protocol of proning so that we're positioning people to reduce the risk of fluid buildup in the lungs and kind of reduce that susceptibility to acute respiratory distress syndrome that we also see a lot of.
And the Wall Street Journal is reporting that the federal government is drafting guidelines for specifically the reopening of nursing homes. What do you think that it's going to take to begin that process?
I think it's going to take extensive testing. It's going to take a measured, scientifically data-driven approach that will allow us to do it as safely as possible. It's certainly something we want to do. I think we're marking now today 2 months since our residents were able to see family members and vice versa, and we know that that is a very difficult thing for them, so we want it to happen. But we're going to follow the CMS guidelines that come out and the CDC guidelines that come out, and we're going to work with them and implement them as best we can, like we have with all their other guidance.
I'm curious also just how difficult it is to get your staff to come in, that they have to be concerned about their own well-being, and what kind of preventive measures you're taking on their behalf.
Well, like I said, we started this screening. We have extensive PPE for all of our staff, and yes, it is a concern, but our staff is really rising to the challenge. We had a story last week out of Indiana, a mother-daughter duo of nurses who work in our facilities, and the daughter came down with COVID-19. She was exposed to it in one of our facilities, and she waited until she was safe to come to work per CDC guidelines. And when she came back to work, she was, adamant, I want to go back to the COVID unit. I want to treat the patients that I've been treating before. It's not just hospital workers, EMTs, who are rising to the challenge here. The nursing home workers are doing incredible work in the face of very difficult situations.
Such dedication that we are seeing there across the board on the front lines. Fred Stratmann, thank you so much for your time. We appreciate it.
Thank you very much, Lindsay.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.